All right, let's dive into one of the most crucial skills in all of nursing, priority setting. You know, it's that constant, high-stakes mental math you do all day that decides who you see first and what you do next. Honestly, getting this right is the absolute key to being a safe and effective nurse. And this isn't some abstract puzzle, is it? This is just a Tuesday morning on the floor. Being able to answer this question and answer it in a split second is the exact skill we're here to build. Because your judgment in these moments, that can be the difference between a crisis averted and a really bad outcome. So, here's our game plan for this explainer. First, we'll nail down what priority setting actually is. Then, we'll stock up your toolbox with some super useful frameworks, some for major life threats, others for general client needs. And then, we'll show you how to use all of it to totally deconstruct and ace your exam questions. Let's get into it.
Okay, so let's start with the basics. When we throw around the term priority setting, what are we really talking about?
Well, at its heart, it's all about creating a rank order for everything you have to do. This isn't just your standard to-do list, it's a super strategic plan that's all based on urgency and risk. Probably the most important decision you'll make all day is deciding what you're going to do first.
And doing this well requires two different kinds of thinking to work together. You've got your foundational thinking, that's your textbook knowledge, right? Recalling the signs of a heart attack. But then you have critical thinking. That's analyzing a real patient who's actually showing those signs and deciding what to do about it right now. Priority setting lives in that critical thinking space. It's how we turn what we know into immediate, sometimes life-saving action.
Okay, now for the fun part. Let's build your prioritization toolbox. I want you to think of these frameworks as specialized guides in your back pocket. When you're standing there thinking, okay, where do I even start? You reach for one of these tools.
First up in the toolbox, we've got the heavy hitters. These are the frameworks you're going to grab for those really urgent, life-threatening situations where, every single second counts.
We're going to start with a classic, Maslow's hierarchy. Now, for nursing priorities, you always start at the bottom of the pyramid. Those physiological needs, we're talking literal survival stuff like oxygen, fluids, nutrition, they are almost always going to trump everything else. A patient's need to breathe comes way before their need for, say, emotional reassurance.
Next up, the nursing process itself is a priority framework. And the golden rule here is so simple. Assessment always comes first. You have to gather the data before you can analyze it, plan, or do anything. You assess a wound before you dress it. You check a blood sugar before you give insulin. Assess first, always.
And now probably the most famous one of all, the ABCs. This is your rapid-fire tool for immediate life threats. Is their airway clear? Are they breathing? Do they have good circulation? That order is absolutely non-negotiable. Because think about it, without a clear airway, nothing else you do is going to matter. It's the ultimate physiological priority.
Okay, so let's look at the next set of tools in our box. These frameworks are perfect for helping you choose between patients or problems that are both important, but maybe not an immediate code blue kind of threat.
I like to call this the new and nasty rule. An acute problem, like a sudden onset of chest pain, is a new threat, and it demands your attention right away. A chronic condition, even a serious one that's being managed, is important, of course, but it isn't an active crisis at that moment. So, you always prioritize the new, unexpected problem.
Now, this one seems kinda obvious, right? But the real key is learning to recognize what makes something urgent. It might be a potential threat, like that chest pain, or it could just be time-sensitive, like administering a critical medication that's due right this second. Urgent needs are the ones that just can't wait.
And finally, unstable versus stable. This is huge. An unstable patient is on a dangerous path. Their condition could get worse and fast, often involving their ABCs. A stable patient, on the other hand, is predictable. Your focus has to be on the patient who is actively getting worse or could at any moment.
Okay, you've got the tools. Now let's see how this all comes together where it really counts for students on an exam. Priority setting questions are everywhere, and we're about to learn how to beat them at their own game.
All right, take a look at this. It's a pretty typical exam question, right? We've got a patient with heart failure, they're at risk for fluid volume excess, and the question asks for the priority finding. This thing is packed with clues, so let's break down how to find them.
The very first thing you do is hunt for the key words. In our example, fluid volume excess is important. It sets the scene. But the real mission directive is priority finding. That's the phrase that should make a little alarm go off in your head, telling you to activate one of those prioritization frameworks we just talked about. You're not just looking for any correct fact, you're looking for the most critical one.
Then you have to ask yourself, who is the focus here? Now, in this case, it's pretty simple. It's the client. But in another question, it might be a family member who needs teaching, or maybe it's another staff member who needs instruction from you. Identifying the person of focus makes sure your answer is aimed at the right target.
And now for the final piece of the puzzle. This is a simple, repeatable strategy that's going to help you systematically chop away the wrong answers and zero in on the right one, even when you're feeling a little shaky. Here's the method. As you read each answer option, give it a quick little code. A plus sign for, yeah, that's probably correct. A minus sign for, nope, definitely wrong, and a question mark if you're really not sure. Now here's the key. If any part of an option is wrong, the whole thing gets a minus. Then you completely ignore everything you marked with a minus. If you have a plus, choose it. Trust your gut and go with what you know. This simple trick stops you from second-guessing yourself into a wrong answer.
Because at the end of the day, whether it's on an exam or at the bedside, all of these frameworks, all these strategies, they all serve one person, the patient. They're always the ultimate priority. This is all about building your clinical judgment so that when that moment comes, you are absolutely ready to make the right call.